The afternoon session features 4 speakers, all from Louisiana, and presenting on data, programs, interventions, and policies in Louisiana. So it's really providing the Louisiana perspective. And so I'll start us off. When we first proposed coming back for an in-person conference, we thought it would be very interesting to provide a 10-year update on where we are with childhood obesity in the state. And as background, you might recall that for 5 years, we produced statewide report cards on physical activity and health in children and youth. And so 08, 09, 10, 11, and 12. So the last one is the one on the far right, which was in 2012. And we haven't done an update since then. So now we're 10 years later. We thought we'd like to present on what has happened in the state over that 10-year period. And if you are familiar with the report cards at all, you'll know that we had several indicators of health and physical activity, and then we would grade them, just like a report card at school. And if you got a grade of A, that would mean that Louisiana's children and youth are physically active, and we're succeeding with the children in providing physical activity opportunities. Then it would go down. B is the majority of children. C would be like insufficient appropriate activity opportunities. And then down at F, this is where we're failing. We're really providing insufficient opportunities for our children, and or they have very low levels of activity. So that's kind of the grading rubric we used. In some cases, we gave an incomplete grade when we didn't have data to inform it. So again, we did this for several years within the state of Louisiana, and this was where we were on several of the indicators in 2012. We see that for overall physical activity, we had a D minus for screen time, which is often used as a proxy measure for overall sedentary behavior. Sport participation was a C, so we're coming in with that. That's one of the highest grades we had on the report card, was for sports. And we got an F for overweight and obesity. At the time, we had probably, I think we were 5th in the nation for childhood obesity in 2012. And at those very high levels, we had no choice but to give an F. So a lot of what we do in surveillance, is linking the data to different guidelines. And the current physical activity guidelines, which were released in 2018, for children and youth, call for the daily accumulation of at least 60 minutes of moderate to vigorous activity every day. Most of that activity should be aerobic in nature, so running, walking, playing, active play, all these sorts of things. Kids need at least an hour a day of activity. And then on 3 days of the week, they should incorporate muscle strengthening and bone strengthening activities as part of that. So this would generally entail more vigorous activities where you're stressing the muscle. It doesn't have to be necessarily resistance training, but muscle strengthening types of activities. And then also for bone health, you want the more jarring, like basketball, volleyball, these sorts of things, which will generate bone. So those are the current guidelines, and they haven't really changed since 2008. So for the last, from 08 to 18 till now, these have been the guidelines, essentially. So what has happened in Louisiana since 2012 for overall physical activity levels? These are data from the Youth Risk Behavior Surveillance System, where it captures aerobic activity 60 minutes a day on 7 days in high schoolers. So it's really the kids meeting the guidelines, yes or no. And the prevalence for yes back in 2011 was 24, and that's the data we had available in 2012 when we last did the report card, and it slipped a little bit. It's pretty much flat, but it's come down a little bit to 21%. So really, in the last decade in Louisiana, physical activity has certainly not improved. If anything, it's gone back a little bit. Another source of data is the National Children's Health Survey. This is a national survey of children of which Louisiana participates in, and this is the question. During the past week, on about how many days of this child, it's being asked of the parent or the caregiver, participated in play or sport, at least 60 minutes a day. And you can see the trend here over time. Here's 2011, 2012, 16, 18, and 2020. So again, not good. We're actually slipping back. And this is before the pandemic, really. This is data just before the pandemic. So it doesn't take into account all what Dr. Anelli was telling us about the changes that occurred during the pandemic. So again, activity, we're kind of holding our own or slipping a little bit in kids. Now, screen time is interesting. I had mentioned, screen time is a marker of overall sedentary behavior in many ways. But the way we use screens has changed dramatically over the last decade. We used to always just ask about television viewing. How many hours a day do you watch TV? And what we see when you ask about TV viewing is it's gone down. So that's a good thing. From 2011 to 2019, we see a reduction in TV viewing. But, my colleagues around the country are talking about this. Does it really represent less screen time, or less sedentary behavior, right? How many kids watch TV anymore? They're not watching TV, they're watching their phone, their iPad, their watch, all this other kind of stuff. So the way we ask about TV viewing, is getting to be more antiquated. So certainly, kids are watching less TV, which is a good thing, but on the other hand, they're tending to watch more things on their video or computers. They're spending more time on the computer over time, which is picking up some of that slack. And then if you delve into it a little deeper, and the National Survey of Children's Health, they asked this question, how much time does a child spend in front of a TV, computer, cell phone, or another electronic device doing all of these things? And look at this, 30% almost are spending at least 4 hours a day on these devices. 3 hours a day is 20, 26 for 2. So the guideline for screen time is really for no more than 2 hours a day of quality screen time each day. No more than 2 hours. But look at this, we have almost 80% here of the population of kids spending more than 2 hours a day in screen time. So it doesn't look good. But this is just a reminder to me to say, we're working with the surveillance systems in the country to adapt their measurement of sedentary behavior because, it's changing so rapidly. Like, by the time we finally get a handle on phone or smartphone use, that's going to be obsolete and everyone's going to be looking at holograms or something. We're going to have to completely change it as we go through. So sport participation, I mentioned that was our highest grade back in 2012. We had a C, meaning we're succeeding with about half of the kids. And that's what we see here back then. It was 51%. That's why we had a grade of C. It went up again, and it's fairly flat, though. We're looking at 51 versus 48. So kids playing on sports teams, at least in high school in this case, is remaining about the same over time. And again, this is state of Louisiana. Whoops. Go forward. So what we're talking about today here with respect to obesity, Dr. Cook showed some data like this. This shows the national trends in obesity over time in different age groups of children. And I think we're all fairly familiar with this. He said in his remarks that the way we measure obesity with BMI is the number of kids above the 95th percentile in the 1960s and 70s. And that's right. If you go back to here, you see 5% of kids were above the 95th percentile, right? That makes sense. By design, it's got to be 5%, right? Above the 95th, it goes to 100. But look what's happened. If you use that same marker Today, overall, it's 19.3%. So before, let's say it's an arbitrary line on that growth curve, 5% of kids were there, now it's 20%. That's just incredible that rapid a change in biology can occur over the course of this time frame, 1970 to 2020. And again, these are long-term trends we want to pay attention to, right? Long-term trends. And you may have heard, like back in 2008, everyone was making a big deal about this. They're like, oh, we've got a handle on childhood obesity. It's plateaued, it's gone down. Well, the nature of data is it's going to bounce around. So yeah, it went down. The next year, it went right back up. So we have to be careful just focusing on, 2001 to 2002. And we have to kind of look at the longer term trends, which is what we're seeing here in all age groups. Now, I wanted to put this on because it shows not only the trends in obesity from 2012 to 2019. This is a different system. This is the National Survey of Children's Health, which is why it's 22% instead of around 2021. Different questionnaires, different surveillance systems give you a little bit different numbers. But again, it's about 1 in 5 kids. And here, this is Louisiana over time, 22.2%. All these other gray lines are all the other states. That's what's going on in all the other states. And you see, again, we're ranked 3rd right now in the country in terms of childhood obesity. So it's trending upwards, and we're ranked among the top in all of the states. So if you wanted to compare then the 2022 grades back to the 2012 grades, we see there really hasn't been much change, right? If anything, physical activity has gotten a little worse. It took a little dip, but the other grades are essentially the same. So we really haven't made much progress in the last decade in the state at improving obesity or physical activity in children. And again, this is all prior to the pandemic, so we can't blame that. Can't blame the pandemic on this. So what can be done? I'd like to leave us on a positive note. Back in 2012 and 2013, we put together this report under the guidance of Dr. Stephanie Broyles, who's here at Pennington, and we call it the PRISM report, PRISM. PRISM is the modeling system from CDC that we used to produce this report. Again, this is 2012. And it's an evidence-based approach to inform policy decisions. So, Dr. Staiano was up here talking about implementation science and about implementing evidence-based approaches. This was what we were proposing back in 2012, the state. So, first thing to note, if you were just look at this table, these are all sort of, different ways policies can be used to help address obesity. The top one is on junk food relative pricing, essentially increasing the price of junk food, lowering the price of healthy foods, kind of relative pricing, trying to make it match or even make it harder to get junk food. We have counter marketing, of the food industry to get, healthy advertisements out there. Let me jump down here first. Access to physical activity spaces, physical activity promotion at the population level, big promotion efforts, billboards, TV, all that kind of stuff. Physical activity in schools, physical activity in childcare. And these numbers represent the change in the obesity prevalence that you could expect if we implemented those policies in the state of Louisiana. So, relative pricing, we could potentially see an 8% drop in the obesity rate, 4% for this, 5% for physical activity spaces, et cetera, et cetera. If we were to implement fully all of these policies, we could see a 26% decrease over a 10-year span in the state. Now, I wanted to come back to this. Fruit and vegetable access and fruit and vegetable promotion, the model showed if we did those things, it really wouldn't impact the obesity prevalence. And this is an ongoing debate in the literature. And So there's kind of two schools of thought around this. One is that if you provide access to healthy fruits and vegetables and kids are eating them, that it could displace them eating other foods. You know, they're going to eat the healthier foods, so they're not going to eat the worse foods. But actually, there is evidence to show what we're really doing is telling them to eat more. We want you to eat more fruits and vegetables, right? So that may be a good thing for overall health, but it's increasing their calories if they don't displace it. So there's evidence to suggest that, you know, although we like to think that getting kids to eat more fruits and vegetables will impact obesity, you don't really see a huge effect in most studies because you're asking them to eat more. Does that make sense from an energy balance perspective? Eat more and you'll lose weight. So again, it's very controversial right now. So there's this displacement hypothesis still, saying if you eat more fruits and vegetables, you'll eat less of the calorie-dense stuff. But so far, there's not much impact from a policy perspective. So more to come on that in the future. But the bottom line is, you know, if we were to enact a lot of these policies, we could see a nice reduction in our obesity rate among kids of 26%. And this model shows that. We start at a base of 30%, because in this case, we used more direct measures of obesity in the state of Louisiana. We didn't rely on those national surveys. We actually relied on Louisiana data that was measured. And at the time, it was 30%. So this is what we would see in 2020. Not much change. This is what would happen if we enacted the policies, and it would get us down below 22%. So, you know, these policies work. They're evidence-based. They can impact obesity. Unfortunately, we haven't enacted any of these in Louisiana in the last decade. So that's where we are. We're exactly where we predicted, right? We're exactly where we predicted a decade ago. So this calls for more efforts at the policy level, I think. And one thing we're doing about this, as Dr. Staiano mentioned, is our Grow Healthy initiative. Bottom line here is we have 35 years of obesity research conducted at Pennington. We're taking that, we're putting it on a virtual health hub, we're implementing across all these different age groups these evidence-based approaches to help address obesity that have been developed here, with the ultimate goal, over time, we're going to reduce obesity, we're going to increase health, and we're going to cut medical costs. So it's all around dissemination of these evidence-based solutions. It's really implementation science. That's our focus now when we talk about childhood obesity. So Pennington's mission is really, you know, to prevent chronic disease and to rid the world of chronic diseases. And by doing this, we need to get our research out into the field. And that's where we are now. It took 30 years to get there, but we're there. So we're very, very, very excited about this. So in summary, over the last decade, there really has been little change. A little change in the prevalence of inactivity, obesity, screen time, these sorts of things over the last decade. Obesity remains at very unhealthy levels. And from what we heard this morning from Dr. Anelli, it's even worse. You know, everything I showed you was up to 2019, early 2020, and you saw her data with what's gone on since then, so it's even worse. But again, is anyone surprised that there's been little change? You know, what have we done at the policy level, you know, to change it in the last decade? So that's a question I have for you, and hopefully we can discuss ways we can change this, how we can influence policy and make this happen. And that's it for me. So thank you for your attention.